Okay, so for this week's discussion, we are talking about ions and ion imbalances, also known as electrolyte imbalances. We had to make a concept map about several different ions and what's going on. Let me pull up my map here and see what I've said. Just a second. Here. Okay, so the first one that I have here is hypochloremia, which is low chlorine in the body. It usually occurs with hyponatremia and metabolic alkalosis. The symptoms are usually acute cerebral edema, confusion with convulsions, and weakness, nausea, muscle twitching, and weight gain. Treatment is fluid retention for 24 hours if no neurological issues are existing as of that time. And then I talked about hypochloremia, which is high chlorine in the body, which is usually accompanied by hypernatremia. They go hand in hand. Manifestations are anemic dehydration and some symptoms of hypovolemia, which is low fluid in the body and the blood, may be present as well. Treatment is to give water and stop water loss. And then I went to hyponatremia, which is low sodium in the body. It's caused by decreased salts in the body. This is the most common hospitalization of ion imbalances. Symptoms that could cause hyponatremia is a diuretic hormone, and this situation, the hyponatremia, is most likely related to diuretics, vomiting, diarrhea, burns, and GI suction. Manifestations are edema, crackles in the lungs, lethargy, headache, confusion, seizures, and it could lead to coma. Cerebral edema also for this issue is a later sign, but it could be caused by hypovolemia and hyponatremia, which could cause increased intracranial pressure, which could cause severe damage. The treatment related to this disorder is replacement of fluids and establish the fluid replacement and infusion until the body goes back to normal, to its normal balances. And then we go to hyponatremia, which is increased sodium. This is excessive salts in the body. It could be from selected infant formulas, Cushing syndrome, which is a diuretic hormone disorder as well, and hyperaldosteronism. Effects of hypervolemia are weight gain, bounding pulse, hypertension, edema, muscle weakness, tachycardia, weak pulse, fever, thirst, decreased urine output, coma, confusion, dehydration. Treatment is to give isotonic salt-free until the salt-free replacement till the sodium level is within normal ranges. Hypokalemia is the next one that I have listed here. It's low potassium in the body. Factors contributing are low consumption of potassium-rich food. This is rare, but it could be related to elderly people not consuming enough fruits and vegetables with potassium in it. It also could be related to alcoholism as well. And the common manifestations for this is muscle weakness, smooth muscle atony, and cardiac dysrhythmias. The main objective is pushing high potassium foods and doing a potassium replacement fluid as well. Hyperkalemia, which is high potassium in the body. Hypo and hyperkalemia probably are the most serious forms of electrolyte imbalances because they do cause cardiac issues, whether it's dysrhythmia or it even could cause cardiac arrest and you could die. So definitely keep in mind the food that you're eating and make sure it has the proper nutrients that you need. But anyways, hyperkalemia is high potassium in the body. I'm trying to see here what I have here. It looks like it could be caused by excessive intake or shift of potassium in your body as well. Hypoxia could lead to hyperkalemia. Hypoxia is when there is not, excuse me, there's low oxygen in the body. And that could be caused by lots of different things, which we discussed previously in another section. And also, the manifestations can vary, but common characteristics are dysrhythmias with an electrocardiogram, weakness, paralysis. So it kind of mimics hypokalemia. So if they're noticing any issues with your cardiac, with your heart, then they're going to rule that it's some sort of potassium ion imbalance. And they are going to try to take care of it as quickly as they can. Because you can't die from that if it's not taken care of properly. What else here? I'm trying to find that on my paper as well that I wrote down. And pretty much the treatment here is to investigate what's going on, because renal impairment can cause hyperkalemia, yeah, sorry, I misplaced where I was going. Also, I mean, it's really just what the actual issue is and what's causing the ion imbalance. You can give calcium gluconate to relieve your muscle twitching if you think that's a problem, if you think that's what's going on, but it just depends. And now we're on hypocalcemia and hypercalcemia. So that's hypo is low calcium in the body and hyper is high calcium in the body. So that's not quite as common of an imbalance, but it definitely is an issue here. So I have hypocalcemia as it could be caused by like nutritional deficiencies, so not enough calcium in the body. So just make sure you're eating the proper amount of calcium. It can also be caused by blood transfusions, which I found very interesting. The clinical manifestations are increased neuromuscular excitability, which can cause nerve and muscle issues. And I learned this in nursing school, but two common signs for hypocalcemia are the Chovestic sign and the Tresor sign. I can't pronounce them properly, but they're two signs that you can check, and they'll test positive if you do have hypocalcemia. Pretty much the treatment is figuring out what the underlying pathological issue is and treating that. So if it's a nutritional deficiency, push high calcium foods. I mean, that's really all that you can do with that as of right now. Hypercalcemia is high calcium in the body. Many symptoms are non-specific, so it's really hard to diagnose this. Mental changes and confusion normally occur, but that's a common sign for a lot of iron imbalances, so that's really hard to pinpoint that. And I'm also seeing here that renal impairment, such as kidney stones, can cause issues too. Let me see here. And the treatment is just like almost every other thing is replacement and treating the underlying cause of the ion imbalance. Now we're moving on to hypo and hyperphosphatemia, which is high and low phosphorus in the body here. Yes. Okay. So this is hypophosphatemia is your low phosphate in the body, and it can be caused by platelet dysfunctions, leukocyte dysfunctions, leukopenia, with reduced oxygen capacity that could cause it as well. It looks like that when oxygen shifts here. Hang on just a second. Okay, I'm very sorry about that. I just had a little mishap with my son. But anyways, I think we're on the last one, magnesium, hypo, and hyper. Um, so it looks like these are less common, of course. Hypo is when your magnesium is low in your body. It looks like it could be related to metabolic syndrome, alcoholism, renal tube disorders, anything along those lines. Just magnesium supplements, it looks like, is the treatment for this issue. And then hypermagnesium is when your magnesium is high. Could be caused by magnesium containing antacids and overconsumption of those. Just decrease the consumption, and that should definitely help. It looks like the manifestations could be depressed skeletal muscle contractions, hypotension, bradycardia, respiratory depression, and anything along those lines. I think that's all I have for this video. If you have any questions or concerns, just get a hold of me. Thank you.